Hi everyone, my name is Akriti and I'm joined back by Sebastian and Suzanne in this new to Barmer Health Talk series. Today we will talk about student insurance and some nitty-gritties of public and private health insurance. So let's jump right into it. Suzanne, my first question is to you. Are all students under 30 years subject to mandatory health and long-term care insurance in Germany?
Hi, Akriti. Thanks for the question. Yes, definitely. Students under 30 years who study at a state-approved university or college in Germany need public health insurance and long-term care insurance. In some cases, an exemption is possible, but you'll need to think carefully about the consequences before making your decision. It's always best to contact your health insurance consultant or us before you decide for public or private health insurance.
Thank you for the answer, but what could those exceptions be? Could you please talk about that?
So you could apply for an exemption at the beginning of your studies. That means you get in contact, like Susanna said, with your personal consultant, with your public insurance, and share with them your private policy. And the public health insurance, like Barmer, will check if the conditions and benefits are at least on the same level, like in our public system. Only then we can give you an exemption, and then you can stay with your private insurance. This decision is very important and should be well considered, because the decision you made at the beginning of your studies will last for all your study. That means if you go with a private from the first day on, then you have to stay at the private until the end of your studies. And it's the same with the public insurance. So yeah, just get in contact with your personal consultant to do a well-considered decision.
Thank you. That was very informative. And this brings me to my next question. Is it possible to somehow switch between public and private insurance during the course of the study of the students that come to Germany?
Unfortunately not. It's not possible to change between the public and the private insurance. Yeah, it's like I mentioned, you have to stay with this insurance you decided from the first day on. After your studies, there it's no problem. Yeah, if you had a private insurance while you study and then you start to work in Germany and have a job, then you could decide for the public insurance.
Thank you so much for the answer, Sebastian. It brings me to my next question that we had from the audience last time. What are the contribution rates for insurance? Can you please answer that for us, Suzanne?
Yes, of course, I can answer that. There are many questions, if it's maybe cheaper or what students have to pay in Germany when they study here. For all the students in Germany, it's not possible to get public health insurance alone. Long-term care insurance is mandatory as well, and both of the contributions are combined. All students pay the same reduced rate for these insurances. And this year, for example, the monthly contribution is around 125 euro per month, plus minus some euro. Sometimes you see that health insurance costs around 90 euro, but there the long-term care insurance is always missing. So don't fall for that. You always have to pay the combined insurances when you study in Germany. But you still have access to all the necessary health insurance services you need. The same like someone who works and pays like 3 times or 4 times as much as you will have the same health services.
Okay, that brings me to my next question. How do students pay for these contributions?
There are 2 options how you can pay your contribution. The first option is that you pay the contribution for the whole semester before the semester begins in advance. The second option, this is the option the most students prefer, is to pay monthly. The contribution is due on the 15th of the following month. That means if you start your semester on the 1st of October, for example, then the first contribution rate is due on the 15th of November. So you have enough time if you need a German banking account, maybe. Yeah? You can open a banking account at this time. And then on the 15th of November, Barmer will take automatically the contribution from your banking account. The only thing we need is a signed SEPA direct mandate from your side.
Okay, that sounds reasonable. Thank you, Sebastian. And just in case some students decide to leave Germany after their studies, how do they cancel their insurance? Do they need to inform someone? What's the procedure? How do they cancel their insurances?
If you're going to leave Germany permanently, you must inform us because otherwise you will still have to pay your contributions. You just go to the residence registration office, which is called Einwohnermeldeamt in Germany, and deregister your address. Then you will get a copy of this, and this you will have to send to Barmer. Also, if you have a flight ticket, you need to send us a copy of your flight ticket along with your deregistration, and then we will cancel your health insurance that you don't have to pay from the moment you leave Germany. So that's very important. Otherwise, there will be receipts every month, which you should pay. So it's really important that you tell us when you are planning or going to leave Germany.
And I assume this would be same for people like non-students who are going to leave Germany, right? So just to understand this clearly, this procedure would be same for all other people who are not student and are leaving Germany. Is that right?
That is definitely right. You always need to inform us or your health insurance provider when you're going to leave Germany permanently. If you're just going on holiday, this doesn't matter. But if you choose, or if your plans are different ones now and you are going to leave Germany for longer and don't work here or study here, you need to inform your insurances because otherwise you would get letters and letters and letters asking, hey, what about you now? Where are you working? Because your employee will also tell us that you stopped working there. And then we're going to send mails or letters. What about your insurance now? And so that we stop this process, we need to be informed that you left Germany. And there we need a flight ticket, for example, or the deregistration from the Einwohnermeldeamt.
Thank you so much for the answers, Suzanne and Sebastian. I'm sure these answers are going to help Indian students and otherwise other students coming from all over the world to Germany to help them understand what is this insurance about and how can they really avail the benefits from public or private health insurances and make an informed choice. So thank you so much for joining us. And if you have any questions, please write to us in the comments or just reach out to us. Thank you so much.